Depression is one of the most common mental health issues, affecting more than 250 million people worldwide. It's not the same as occasionally feeling the blues. For some, it can be debilitating, leaving them unable to work. Symptoms include an all-encompassing feeling of sadness, irritability, hopelessness, insomnia, body aches, and, at its worst, can lead to suicide. Although it's widely recognized as a serious mental disorder, there is still considerable confusion over its origins. What causes this widespread mental disorder? Depression is a spectrum disorder that comes in many forms. For a long time, a widely recognized hypothesis for its origins took the spotlight, called the monoamine hypothesis. This theory suggests that depression results from the underactivity of three monoamine chemicals in the brain: the happy hormone serotonin, the pleasure hormone dopamine, and the chemical norepinephrine, generally responsible for the fight or flight response. This theory led to the majority of treatment options focused on fixing these imbalances. However, the results of a new study suggest that monoamines are not always involved in depressive behavior. The theory can't fully explain the complexity of depression, and there is a persistent uncertainty over whether the chemical dysregulation is, in fact, a cause or instead a symptom. There have also been conflicting studies over whether or not genetics plays a role in depression. The current evidence suggests that depression involves both genetic and environmental factors, with genetics being linked to severe and recurrent depression. So, is depression a mental or physical illness? When you're sick or injured, you can feel tired and lethargic. This is because of your body's immune response. The brain tries to conserve energy so the body can heal. However, this immune response can also be found in some people with depression, leading experts to hypothesize that certain forms of depression may be a side effect of the inflammatory process. This speculation was supported by research showing that depressive states can be induced by administering immunogenic agents, such as vaccines, that result in an inflammatory response. However, not everyone who suffers from depression shows evidence of inflammation, and not all people with high levels of inflammation develop depression. So it's too reductive to say depression is a physical rather than a mental illness. There are some types of depression strictly related to an episodic event, like postpartum depression, or PPD, following childbirth, or even before giving birth. There is no widely accepted explanation for what causes PPD, although science tells us that physiological, situational, or hormonal changes can play a significant role. A link between gut bacteria and depression has also been found. In a study by Belgian researchers, two groups of bacteria, Coprococcus and Dialister, were often depleted in people suffering from depression. These bacteria can produce and interact with neurotransmitters such as serotonin and dopamine. And yet, even though the team found an association between depression and certain species of bacteria in the human gut, the study couldn't test for a reason or a cause. Lots of external factors such as exercise and even lighting may have an effect on mental health too. Seasonal affective disorder, or SAD, is a form of depression that aligns with the changing of the seasons. For more information on SAD, take a look at our dedicated video on the subject. Nowadays, even social media has been linked to depression. It has infiltrated many of our lives, with roughly 3 billion people focusing on apps for an average of over 2 hours a day. More and more research is supporting the link between social media use and feelings of depression, anxiety, and loneliness. Researchers have also unveiled a class of words that can help predict whether someone online is suffering from depression. With the help of some computerized text analysis methods, it is possible to spot linguistic features that show symptoms of depression, such as the excessive use of words conveying negative emotions, like sad and lonely, lots of first-person singular pronouns like me and I, and absolutist words such as nothing and always. That said, it is possible to use language associated with depression without actually being depressed. Ultimately, it's how you feel over time that determines whether you are suffering. There are many treatment options available for those who have been diagnosed with depression. These are grouped into two major categories: pharmacological and non-pharmacological. There are a variety of medications that help to manage symptoms and improve quality of life, and working with a physician can help determine which medications are the best fit. More recently, the US government has even tested psilocybin, a compound found in magic mushrooms, as a breakthrough treatment for major depressive disorder, putting it on the fast track for future clinical studies. Antidepressants tend to work best when partnered with counselling sessions with a trained medical health professional. Cognitive behavioural therapy, or CBT, is a type of talk therapy aimed at patients identifying with destructive thinking and behaviour. CBT has been found to be as effective as antidepressants for people with moderate to severe depression. General lifestyle changes are also recommended to make things easier, like getting more natural light. There are also special lamps called light boxes that emulate sunshine and can help regulate your serotonin production. Physical activity has been shown to reduce moderate symptoms, and finding enjoyable hobbies such as art or music can help channel and release some negative emotions. Seeking treatment for depression is no different than seeking treatment for cancer or a broken bone. Don't take on this challenge alone. Please remember that you aren't alone and that you can get through this. If you have questions about your mental health or medication you've been prescribed, speak with your doctor. Suicide crisis lines can be found in many countries worldwide. Take a look at the link in the description of this video to find out more.